Hello everyone. In this video we will talk about refeeding syndrome. So refeeding syndrome is a fatal condition. It is a bunch of metabolic and electrolyte abnormalities which happens due to rapid and excessive reintroduction of calories in individuals with starvation or malnutrition. So when a person is already starved and malnourished, when we give them food but we give it too much and too rapidly, too rapid introduction of calories is done, then it leads to a bunch of metabolic and electrolyte abnormalities, and that results in refeeding syndrome. Refeeding syndrome can happen when nutrition is given through any route. It could be oral nutrition, enteral, or parenteral nutrition as well. Let us look at the pathophysiology of refeeding syndrome. So, what happens in refeeding syndrome is when in a person with chronic malnourishment and fasting, usually what happens is insulin is decreased. Obviously, we know that when a person is in fasting, the insulin will be less and glucagon and cortisol will be more. They will try to increase blood glucose, so insulin will be less and glucagon and cortisol will be more. So the processes going on in such a person are catabolic processes like glycogenolysis, gluconeogenesis, and protein catabolism. Apart from that, obviously in a fasting or malnourished person, all your micronutrients will also be depleted. Such a person, when refeeding is started and it is given too much, the insulin increases. Insulin levels increase. When insulin levels increase, it is a net anabolic hormone which will cause protein synthesis, which will increase proteins, and it will also cause glycogen synthesis. Now we know that during the formation of proteins and glycogen, we require a lot of other substrates like potassium, magnesium, phosphorus, thiamine to catalyze the reactions. All these are required for the synthesis of these substances. But since these nutrients were already depleted due to malnutrition, when they are used up even more to form substances like glycogen and proteins, they get depleted even more, which leads to hypophosphatemia, hypokalemia, hypomagnesemia, thiamine deficiency, and sodium and water retention, which are the main electrolytic and metabolic abnormalities which take place in refeeding syndrome. Now, because of all these metabolic abnormalities, we have a vast array of clinical features, which in the CNS includes seizures, delirium encephalopathy. In the CVS, it leads to arrhythmias, hypotension, and congestive heart failure due to sodium and water retention, renal failure, paralytic ileus due to hypokalemia, peripheral edema, paresthesias. In the muscle, it can lead to fasciculations and rhabdomyolysis, also respiratory distress and anemia, thrombocytopenia, and WBC abnormalities. The main risk factors or risk groups include a patient who is undergoing starvation, chronic alcoholism, in an anorexic patient when we start refeeding, in a patient who is obese and has undergone massive weight loss recently, somebody with a malignancy or critically ill patients, also somebody with malabsorption syndrome. Mainly BMI less than 18.5 or a recent unintentional weight loss of more than 10%. Remember, this is unintentional weight loss. And somebody who has taken little or no food in more than 5 days. These are moderate risk factors. Management is done by giving only 10 kilocalories per kg per day of nutrition maximum. More than that has to not be given. Only up to 10 kilocalories per kg per day. Along with that, constant electrolyte monitoring and electrolyte repletion has to be done in case they are low. Thiamine supplementation has to also be given.